Hello, hello, hello. Good morning, good afternoon, or good evening, depending upon where you're joining us from, across the coast to coast. I'm your man, Standing Man Martin from Reach Buffalo. Happy to be back here in the seat and to be here with you all once again. Welcome to Reach Talk. Also, I want to give the chance to have my esteemed colleague to introduce herself. We ain't seen her in a minute or two. I haven't at least, but Ebony, why don't you go ahead and introduce yourself, please?
Hello, everyone. I'm so delighted to be with you all again, whether it's morning, whether it's afternoon or evening, where you're watching us today. I'm Ebony White, and I am from Reach Buffalo as well. So I'm just glad to be with you and excited about our guest and everything that we're going to share with you on today. Get your pen and your notepad, as usual.
Absolutely, absolutely. Thank you, Ebony. Want to just say before we get into our discussion, as we spill the tea, or as we sometimes say here, want to give folks who might be joining us for the first time just a little bit of background, just in terms about Reach. Reach stands for Racial and Ethnic Approaches Towards Community Health. We're working hard out here in Buffalo, New York, y'all, on the east side and on the west side of Buffalo to address and reduce chronic disease amongst, those populations, primarily African Americans and people of color who have some of the greatest needs, and especially when we talk about chronic disease, when we're talking about, how do we combat COVID. So this is a space where we're trying to come together and we like to blend. I call it edutainment, education and have some fun, in a real interactive way that allows us to share information so that people can make an informed decision about their health and wellness and overall wholeness. So thank you for joining us this morning. We have an esteemed guest here from GBUAHN. I don't want to steal her thunder, but Natasha, why don't you go ahead and introduce yourself, please?
Hi, everyone. I'm glad to be on this platform. My name is Natasha Pearson. I am a psychiatric mental health nurse practitioner, board certified, and I'm originally from Buffalo myself. And, I'm just excited to be a part of the community where we're trying to educate more of the Black and Brown community regarding the health disparities amongst us. So I thank you for allowing me to be on the platform with you today.
Thank you, Natasha. All right, as we go forth and change the world, as we spill the tea, as I said, I'm going to pass the mic on back to Ebony. Ebony White, why don't you go ahead, Ebony, and take it away?
You know what? So Natasha, my ears are like, I'm so excited and ready to hear what you're going to share with us. But can you tell me about the organization in which you work for? I mean, you shared, where you are and how long you've been in that space, and what are some of the community initiatives that you're a part of currently?
So yes, as you spoke, I work with both GBUAHN and Urban Family Practice, which is our clinic. So here I am the director. I'm also the nurse practitioner to deal with the mental health disparities of our community. So our initiatives is more of getting the awareness to our community, primary care, to be focused on the Black and Brown community of the underserved population. So my job is to encourage more of our Black and Brown community to seek help with their mental health, any mental health awareness, because there is a stigma. So we're trying to get rid of that stigma and educate people more on the mental health with the COVID pandemic.
So you jump right on into it. Mm-hmm. So when the pandemic first started around COVID, what were your thoughts in your approaches as well to addressing in those specific hats that you kind of serve in as behavioral health and primary care as well? And what are your thoughts currently after being 2 years in this space?
Initially, when the pandemic first started, the thoughts were, I was working in the nursing capacity at that time in oncology. So trying to stay positive of what because we were unknown. We didn't know what this virus was. So we were, trying to educate people on what we didn't know, but from the information that was being brought to us by the CDC. So we were, initially we were all scared because we did not know what this was. 2 years now, I think that we have advanced a little bit about educating, and we're more aware of the virus now. So we are able to educate people more and kind of build more of a trusting understanding of what is happening here with this pandemic. So I think 2 years we have advanced a little bit, but it's still work to be done.
Definitely. So can you share just some insight to how this has impacted your clients on a day-to-day basis? So what are some things that they may be struggling with, where you're constantly reinforcing, reestablishing approaches and coping mechanisms at this time?
Well, of course, as we know, when the pandemic first started, people having to quarantine. I think that the anxiety of everyone, this pandemic has brought awareness to the mental health issues, okay, that we had, that people really didn't talk about. Okay. I've seen an increase in anxiety and depression. A lot of clients, and it has affected them, whether it was employment, whether it's, being the unknown about the virus, not knowing what's going to happen, not being able to function that we were prior to the start of the pandemic. So I have seen an increase in clients of anxiety from all walks of life, okay, from all professions and non-professions, that there is an increase, and we need to be more educated on what to look out for, to allow the members to be more aware of mental health and behavioral health. What I'm doing is doing more of an education platform of educating when I see the members and the clients come in, just to have conversations, and let them know about the resource available if they need to talk, therapy, coping mechanisms, things that they like to do, encourage them to do those things, meditation, exercise, more of a health, eat better, try to get more of a different sleep hygiene, things in those nature.
That's awesome. That's awesome.
Yeah. No.
Yeah.
Mind if I chime in? Oh, go ahead, Ebony. Go ahead.
No, I appreciated that she brought to the table saying that it was all walks of life, different social and economic status. It didn't matter. It didn't matter what color it was. It impacted us all inclusively. So I appreciate you sharing that from your space and from your view.
Yes.
And bringing that perspective into vision for our listeners. So it impacted everybody.
It did. And for our community, especially the Black and Brown community, as we know, in our community, mental health is not something that was discussed, okay? Or if it was handled, what's done in the house stayed in the house, okay? And it just wasn't talked about. It's a stigma, and it's not something that we were educated on. We never spoke about that in the Black and Brown community, okay? We were educated that if somebody's having a mental behavior problem, then we separated them instead of including and educating and being aware of what's happening. So I think those disparities that we have in our community, we need to work on more of educating our population, our underserved communities about these issues and what to look out for, what the resources are that are available for them. I think more of awareness, people be more engaging into things and educated on.
Yes. Thank you, Natasha. I really appreciate that. And, thank you for the question, Ebony. And, I would be remiss before we went forward, if I didn't give a shout out to Dr. Vasquez,
Yes.
over there at GBUAHN,
Yes.
as well as the entire team, your entire team over there. We have a action group. I'm going to call it, for lack of a better term. Hopefully they don't come after me later. But we have an action group called HEAL, Health Equity for African Americans and the Latinx community, HEAL, okay, HEAAL. And, we work very closely with GBUAHN to do what you just said, to increase awareness and education, surrounding the importance of vaccination, not just COVID, but, a host of other, health disparities. But seeing how we're talking about, COVID in this space right here and now, just in your opinion, or just what you've experienced, Natasha, why do you think, COVID continues, to be a health issue? We talked about, you mentioned mental health. Are there any other factors that you consider why this continues, to be what it is today?
I think it's a lack of education, lack of communication. It's a lack of trust, especially in our community. So we can all go back. I hear people of the generation of the Tuskegee Project trying to get those individuals in that age, which was baby boomers and before, okay? They are very reluctant to vaccinations because of the Tuskegee Project, not trusting, what are we getting, what this vaccine is. People have to, what I did was I educated my people that would come in and let them know when we were first born, we were getting vaccinations. We didn't know what was in those vaccinations at that time, but we were getting them. This is the same thing. Also, the vaccinations that we were getting at that time were actual viruses. May not have been that strong of the virus. However, this is a protein. So educating them on the differential of the vaccines that we're getting and that we did get, they became more trusting, building that trusting relationship. I think that's what is the issue. Educating them on what is actually in the vaccine. Okay, not just saying we have the vaccination available, but what's in it. What is it? What do we see is going to occur if you do get this vaccine? Educating them. When you feel a certain way, this is because of X, Y, and Z.
Right. Absolutely. You touched on so much. You talked about mental health. You talked about education, because there's a lot of misinformation that's out there, especially on social media, and and also about the building trust and having that rapport.
Yes.
I think sometimes we underestimate that the relationship that we have, as a health professional. Look, I'm wearing a white jacket now as a health professional, and with our clients and with our patients, and that's very powerful and influential. So I'm glad to hear that, at least in your experience, you're taking the time to meet people where they're at, one-on-one conversations, and dispel some of those myths that is that's out there surrounding this subject. Based on what go ahead, please.
What the problem is that, like you said, and I'm glad you said that, meeting people where they're at. Everyone cannot be spoken to in a medical terms. Okay. I like to give them exactly what it is, and be honest of what it is. Not talk to them as though, because I'm a provider, I'm going to tell you in a medical term and expect you to understand. Okay. When you're not, and half of the time we all have been there. Your doctor's talking to you and so much things are being thrown at you. And after a while, it's a shutdown because you don't know what's being told to you. You're not educated on what is being said. Okay. So my thing is to address primary care in our underserved community.
Absolutely. I appreciate that. When you mention the terms, reaching those primarily who are in the underserved communities, what are you hearing? What are you seeing? What's working, what's not working, or here locally.
Well, I think social media, of course, is working because of we have the generational gaps here. For the younger generation, social media is definitely working. Word of mouth is working. What's not working is the information is being thrown out from different outlets. I feel that if the CDC, the World Health Organization, if those things were coming directly from them and not from political, I think, and it will decrease the confusion. because now they're getting it directly from the CDC and the World Health Organization instead of from political means.
Yeah, you touched on, the big brother, the government. Some people trust their physicians. Some people trust their pastor. And then also, when we look at the government, there's a huge mistrust, even from the CDC or the World Health Organization. So we have to rebuild that trust. And I think with individuals like yourself and Ebony and others who are working in this space, we're trying to build that rapport so that we're meeting people where they're at, that they're informed, and they can make a healthy decision, not just for themselves, but for their family and for their community. I want to switch gears just a little bit, because I think what you also heighten our awareness about, Natasha, the importance of relationships and the skills of being able to meet people where they're at and have this conversation. One of the things that we're trying to do, I'm gonna lean into Ebony a little bit. We're gonna have some trainings on identifying, recruiting influential messengers, in this space, in this area. So I don't know if Ebony, you want to talk a little bit about some of the conversations we're planning on having and some of the trainings that we're looking to host here locally. Then we'll come back to you, Natasha, as well.
Okay.
So this has been awesome. For anyone's listening, this is valuable information. But what we are providing with Reach Buffalo is a way for you to have a conversation with your family and friends. And I want you to know how influential you are. Some people don't realize how influential they are. Your yes makes a difference for so many people, and just how you will be. We want to equip you with some skills you already have. Some of them you don't even know that you're utilizing normalcy. You don't realize you're using active listening. So we want to spend some time with you and give you some essential skills on how to have conversations around COVID without a fight or any strife. We want to make sure after you have the conversation, you leave the door open, the light is open. And respectfully, even if you have some difference of opinion, you're still respecting one another. I think that's valuable. So we will have them shared on our www.reachbuffalo.org. You'll be able to find those trainings, or check us out. If you are not our Facebook friend, Reach Buffalo. You need to be our friend. We have valuable information posted on Facebook weekly for you. So, and if you are a provider or a church group and you are influential as a champion in your community, we all play a major part in this work. So these trainings will be up and ready and available to you. And Stan will share some other information to some other groups as well that we're working with to make sure we have champions in that space as well.
Yeah.
So I like that you brought about the church, because that's what we're doing. We're partnering with local churches because people trust in our community, we trust the church. So if we build that rapport and continue the partnership in these specific zip codes and areas where there's been so much disparities and they've been left out, if we partner with these churches that we've been doing, we continue to build these relationships, and people will come in and listen and become more educated, to what is happening around, and especially with the COVID pandemic.
Yes. Like as I sometimes say, no wrong door, no missed opportunity. In this case, and one of the things I wanted to share is that we're going to also be trying to reach that 18 to 24 age group. Those who are unvaccinated and who are hesitant, or they fatigue. People are COVID out. They've heard a lot of information, and they just fatigued, exhausted, tired. Oversaturation, as they say in the media world. I think I had to fact check that later on. But Natasha, any activities that you all at GBUAHN are doing? I know you mentioned working with the faith community to work with that younger audience, to reach those who are unvaccinated. Anything in particular?
Well, we have a lot of things through all the social media platforms to try to encourage that gay age group. We're trying to get out into the schools. We're partnering with like the Buffalo Public School to try to get more awareness, flyers out in the school system for the kids that are in high school. Trying to get the community centers. We're trying to push for more, like celebrities, who they look up to.
Mm-hmm.
Those are that generation they look up to. So if we get more people of celebrities, social medias, to try to encourage that age group, to try, as far as getting them to push, to encourage them to get vaccinated, get the education and awareness out there. And also not even just for the vaccination, also for other health disparities that they may have. In our community, we have diabetes is the number one thing that has affected the Black and brown community. Okay. We're trying to get that education out to the young folks. We're trying to get to the African-American males because we have an increase in colorectal cancer within, we're trying to get that information on breast cancer. So when they come in, we're trying to encourage them to get these tests. So, not just with the COVID, but also for other health disparities.
Right. And I think in terms of the, like we talked a lot about the individual and the community as a whole. And I think that, GBUAHN and, yourself, it's, like you're doing you're trying to change the environment, create access as well. Anything up and coming with like the mobile vans, mobile units, things of that nature?
Yeah, so we have the mobile units where, like I said, we're partnering with the churches. So the other day we were at a church that was located on Rollers and Northland. So we're in these churches that we're partnering with, and where our mobile units will be stationed. We'll be providing vaccinations and testing and education at the same time. So we will have providers on there. We can have people that what we have is patient health navigators to help get people signed up for the services that we provide on GBUAHN as far as care coordination, to help them with social determinants of health. So we have all those people that will be there on these mobile units to provide the education to community, whether it's the COVID, whether it's diabetes education, those things there.
Great. I think one of the things that would be, and correct me if I'm wrong, not just COVID, will people also be able to get vaccinated for flu as well?
Yes. So the flu vaccine right now, because it's coming on to the end of flu season, we don't have the flu. We're primarily doing the COVID vaccination. If they come into the office for primary care, because we're trying to push that as well, we do make sure that people have those vaccinations that they need to stay up to par with. So, we want to make sure when they come in for a physical that they have all, the pneumo vaccine, the flu vaccine, the Tdap, those things. So that is provided in our primary care. But on the mobile units, it would be more of the COVID vaccinations.
Right. Okay. No, we appreciate that information, that knowledge. That's very powerful. Is there anything you want to share with our listeners, myself and Ebony, that we haven't discussed yet that you would like to go into?
I just want to, with this platform that we just continue to encourage our Black and brown community, is to become aware, educate yourself. Everything is not a gimmick. I want my people to be educated and to understand and to be okay with acknowledging that they may have mental health issues, and it's okay. Okay. And that we have resources to help them. So I'm trying to push more of a wellness for them to see people that look like them, to provide these resources, to let them know that there is African-American therapists that can help you. And we acknowledge that, listen, there's no judgment, okay, that we are all going through anxiety with this pandemic, and it's okay. And we're here to help. And we have the resources available for you.
Yes. Thank you for leaning in on that, because the messenger is just as important as the message. And that's for sure.
Mm-hmm.
Ebony, I just wanted to leave our listeners. I'm gonna turn it back over to you. That when we were talking earlier about some of the listening sessions, the learning sessions that we're going to be offering to the community, we're going to be working with Buffalo Prenatal Perinatal Network to offer some trainings on March 4th and 25th. Stay tuned for that training. That's going to be specifically for health professionals, doulas, and those who work with pregnant and breastfeeding women, to have this conversation, as Natasha so eloquently shared, about having this conversation with your patients, with your clients, meeting them where they're at. You as a physician or a provider, you have tremendous power and influence, and is a resource, in terms of helping, our priority populations live a quality, way of life. And in addition to our family conversations, we're looking at a host of virtual trainings, I should say, that we're going to be having on March 3rd. And more information will be posted on our Outreach Buffalo page, on how you can find out more information, how you can possibly even register, if you're eligible or have the time, to attend. So stay tuned, for that. So, Ebony, did I miss anything you wanted to share as well with the time we have remaining?
You know what? I think we gave a lot of information, but I really want to make sure any faith community, faith leader that would like to make sure that their patrons in the 5-mile radius around their church has access to COVID vaccines, contact GBUAHN, okay? That is www.gbun.org or www.urbanfamilypractice.org. Contact them, get that mobile unit out there to your parishioners, get them connected to the things that they need. Also, for all of our upcoming trainings, everyone, you play a major role, and you're so influential in our success. And I want to I don't have on a hat today, but I tip my hat off to all of us, because everyone, give yourself a round of applause, because we've come a long way. Yes, we have. And we didn't do it by ourselves. We did it together. Mm-hmm. Everybody played a role, from grandma at the table scolding someone to aunties, uncles, cousins, mamas, daddies, preachers, the bus monitor, everybody to our amazing. And I look forward to having a show and other people contact us here that worked in this space during a hard time. I thank you. We all thank you for doing that, and just kept pushing. But then, as always, I hope that you found our show to be, you learned a lot, you're enlightened, you're able to go and share this with someone else. Like our page, join us every other Monday at 6 p.m. for Reach Talk. And again, Stan, would you want to conclude with our logo, our message that we continue to put out? We do it for ourselves, we do it for our family, and we do it for our community, because we're all community here.
Exactly.
Have a good one.
Yes, many hands make light work.
Yes. And I want to thank you guys. I want to thank Ebony and Stan for you having this platform and getting this information out to our people.
Thank you, Natasha, and our engineer, Angelita, behind the scenes, making it all come together for us.
Right.
Thank you, everyone. Have a blessed day.
You as well. Thank you.
Reach Buffalo, promoting a healthy community. Reach racial and ethnic approaches to community health locally in Buffalo to reduce racial and ethnic health disparities and rates of chronic disease. We want to make a change by reducing exposure to tobacco in housing and work areas, by increasing access to nutritious foods, by creating a breastfeeding community, by increasing referrals to primary care and community health providers, and by implementing community work groups. Reach Buffalo will concentrate on Ferry Street itself, as well as a community that resides within 4 blocks to the north and south of the corridor in 5 zip code areas: 14208, 14209, 14211, 14213, and 14215 in Buffalo, New York, with disparities in rates of chronic disease. Get involved. Ferry area residents will have an opportunity to have a platform to voice their opinions, organize, and make decisions in these efforts. For more information, you can contact Ebony M. White, Community Outreach Coordinator, at 716-268-2954.